And it could still be days before the government reopens.
Tonight, tens of thousands of St. Louis area families are bracing for sharp hikes in their health insurance premiums, just as the government shutdown finally shows signs of winding down.
Yeah, lawmakers are talking about a vote next month to extend federal subsidies that help keep those costs in check. But tonight, there is still no deal and no guarantee. We're taking a closer look at the price of reopening the government without a health care fix. Political editor Mark Maxwell digging into those details for us.
Yeah, hey Brent and Ann, if you're one of those tens of thousands of families on the Affordable Care Act exchanges, either in Illinois or Missouri, you're probably suffering some serious sticker shock right about now after opening your mail or your inbox. Notices going out right now are showing the coming cost of health insurance premiums on the Obamacare marketplace. Because Congress appears poised to reopen the government without any extra funding to keep those costs down, policy experts at the Kaiser Family Foundation show the following price hikes coming in the new year. Take, for example, a 60-year-old couple in East St. Louis, a household income of $55K. They'll see their bill jump about $2,400 a year, or an extra $200 a month. Or take a Florissant couple in their mid-50s. Let's say mom cleans houses, dad owns a small construction company. They make a household income together of $140K with two teenagers. They're about to see their costs jump a stunning $17,700 a year, almost $1,500 a month, enough to be a mortgage. Or let's say you're a single hairdresser or barber in Fenton and you make $42K a year. You're going to pay an extra $1,700 a year, about $150 more every month for the same coverage. Congressman Raja Krishnamurthy, running to replace Senator Dick Durbin in Illinois, says these looming price hikes will ultimately push people out of the market and off of their insurance plan.
A family, let's say a couple who's 60 years old, so they're not old enough to qualify for Medicare, making about 400% of the poverty line, right now pays about $6,000 to $7,000 in health insurance, so $500 a month. Now that the tax credits are expiring, that premium is going to jump to $2,000 per month or $24,000 a year, meaning they're not going to be able to afford health insurance.
Not the only Illinois Democrat sounding that same alarm. Senator Dick Durbin helped to broker this deal to reopen the government, even as critics in his own party say he's giving up too much leverage here. Congresswoman Nikki Budzinski says the deal, quote, sells out working people. Lieutenant Governor Juliana Stratton, also running for a seat in the Senate, insists that Democrats should have held the line here and refused to let health care and food access become bargaining chips. But in his statement explaining himself, Durbin said Democrats, quote, secured full SNAP funding and reversed the Trump administration's mass firings. He admits this bill falls short of a permanent health care fix and argues that it buys time for that big vote next month on those expiring Affordable Care Act subsidies.
So, Mark, when it comes to SNAP, when can people expect to see those benefits show up, those cards to get loaded with some money?
Yeah, that's a big question. Right now, it's still unclear exactly when those food and nutrition benefits will show up on people's card in their full amounts. I've reached out to both Missouri and Illinois state government agencies that oversee the SNAP distribution programs. The one thing we do know, President Trump's White House lawyers have gone back to court just today in an effort to block states from making full payments until the government shutdown is over.